I'm Marc Rowland, I'm Chair of Lewisham CCG, and I sit on the London Health Board on behalf of the 32 CCGs. I would say if not more importantly, I've been a GP in Lewisham now for 38 years. I see the real health and social care challenges of my patients firsthand and on an almost daily basis. Not quite daily now, which my colleagues tell me I get the cushy options being up here rather than doing the day-to-day work. So I'm very excited by the energy. It's lovely to see a room full of people. I know many people, and I know how dedicated everyone is to the changes that are occurring. The whole health and social care system are coming together from across our absolutely wonderful city to do something radically different to improve the health of Londoners. This collaboration and the partnership working has been made possible by Lord Darcy and the work of the London Health Commission and by the continued efforts of our local and London-wide initiatives, and also the very clear national steer of the 5-year forward view. We're seeing real innovation in terms of how we commission and how we deliver care, and a united focus on the need to secure improved health and to reduce inequalities across our many and varied communities. I was interested to pick up on your point in New York about the inequalities there, and I'm becoming more and more aware of the work that we need to do. I do believe that our work together will be key to the transformation of the health and care of my patients and all of London's citizens. As commissioners and as clinicians, we're working very hard with our partners to make London the world's healthiest city. I'm sorry, we got to try and get there. We're committed to making real progress against all the aspirations set out in the Better Health for London. And we look forward to continuing to work with the whole of London, our partners and our communities to enable people to live longer and healthier lives. Now, I know I'm just a bit filling in for all the interesting stuff, so I would now like to introduce Simon Stevens to take the stage. Thank you, Simon.
Thanks, Mark. And it's a great pleasure to be here, joined by all of my national colleagues, the full board of NHS England here in force to show our huge support for the work that Boris and Anne and Teresa and Ara have been leading over the course of the past year, and that which today is not just a moment to take stock, but a moment to put gas in the tank for the next stage of this journey. The reality is that there is a lot that we can be very proud of in the health service in London, but there's also a lot that we can see is not good enough. As Boris rightly said, there have been great gains in health and life expectancy over the course of the last 5 and 10 years, but that is not the story everywhere. 10 minutes from here, there is an estate called the Angeltown Estate. If you read the Evening Standard, you would have seen a fortnight ago a whole week devoted to the life and health experience of people living on the Angeltown Estate. Described perhaps a little over-exaggeratedly as a notorious housing estate struggling to overcome violence and deprivation, but the facts are that that life expectancy gap does exist there. The fact is that the crime rate is 2 and 3 times higher. The fact is that despite a substantial rebuild in the late 90s, that is a community under severe stress. 15 years ago, I was the elected Lambeth councillor representing Angeltown Estate, Loughborough Estate, and so looking at what's happened to the 4,000 or so people who live on the Angeltown Estate is in a sense a microcosm for the inequalities challenge that faces us all. As Teresa said, we are not at a point in our history, our economic history as a nation, where unfortunately we are being cut a cheque to spend our way out of trouble in the same old, same old. And so under those circumstances, we've got to look at the assets that are at our disposal but have been hitherto unexploited. And we've got at least 5. We have the National Health Service. And despite much of the excellence that exists in the healthcare system of New York, and I love New York City Health Department, not least because when I worked there 20 years ago, I met my wife. because as she points out at the time, there was a hiring freeze, so I was the only straight male under age 50 at the time. But I love New York City Health Department. The fact is that we have a great opportunity in this city that the people of New York do not have if the NHS can get its act together and be more than the sum of our parts. So that's the first of our potential asset-based advantages. The second is that we do have vibrant democratic leadership, not just at the level of the mayor, the GLA, but also the boroughs. And frankly, we in the NHS are asking those of you who are our elected local leaders to step up and be more lippy on some of the topics, exactly in the way that Boris and Theresa have described. We will follow your thought processes as reflected in the meanderings and musings of your inner mind, Boris, on the sugar tax over the coming weeks, but don't make it months. The time is upon us to come to some conclusions on this and other approaches to obesity reduction.
Are you in favour?
I do think that we've got to take sugar out of the added sugar out of the food supply. I think reformulation actually has got, it should probably be towards the top of the list in the same way as we've taken 15% out of salt, added salt over the past 10 years. We've got to do the same on sugar. Whether the threats of a sugar tax are part of what will bring people to the table to do that, I think is a good question. I think Jamie Oliver's testimony this week about the impact that the sugar tax in his restaurant has had was very powerful. And to the extent we are short of cash, then I think there's a great case for giving local authorities revenue-raising powers linked to public health bads. So, like you, I think we will choose our moment to answer the exam question, but it's important to keep open the possibility that that is indeed where we should be headed.
So it's yes, then.
I don't know whether we're being tweeted here, so I will therefore, we will choose our moment when perhaps Boris and I will have a meeting of minds on this topic with my new best friend Jamie Oliver. So we've got the opportunity that local democratic leadership represents. We've got the fact that the wider public sector pound is not being properly joined up in this city. So although there has been fantastic work over the last year, thanks to Ara's recommendations on healthy schools, for example, 1,500 healthy schools, I think more than 2/3 now across the capital. The role of social care is obviously going to be a huge pressure point over the next 5 years for all the reasons that Theresa says. Housing, the need for new housing that affects key workers, including the staff that we need in the National Health Service. We've got to think across the totality of the public sector pound. We've got to engage the private sector and employers, not just the NHS employer, private sector employers, and above all, we've got to engage communities, including people living in places like the Angeltown estate. So those are our assets, that's our opportunity, that's what we have not at this stage effectively harnessed collectively to deliver on the health and care improvement agenda that we have set ourselves. And so I think our task now, 1 year on from Ara's 10 priorities, 60 recommendations, is to say what are some of the big ticket items where when we're standing here in a year's time, and we will invite Boris back for the rematch, when we're standing here in a year's time, we will actually have made progress on. And so first and foremost, I think the prevention piece, and that absolutely is obesity. In the way that we've just discussed. 40% of kids starting secondary school in this city obese or overweight, the worst of any of the world-class cities that London benchmarks itself against. Yes, smoking, that is not a job that is yet complete. The aspiration, 13% smoking rates by 2020, still far and away the biggest killer in this country and in London, explaining half of the life expectancy gap between rich and poor in Britain. That's not me, by the way. On employers, the reality is that the NHS has not been a fantastic support for our own workforce in terms of the health and well-being of hard-pressed nurses, therapists, porters. We've got a job of work that we have begun, but we need to extend that and pick up the fact that I think 180,000 employees across London now engaged with their employer, private sector, on the workplace health challenge, which has been supported by the GLA. Why is that 180,000? Why is that not 1.8 million? Why is that not approaching 2/3 of the workforce of this city? That's part of what we've got to do. So we've got a huge agenda on prevention, and that is going to pay great dividends, not just for our citizens, but also for our public services, including the NHS. The second is we've got a big agenda on care integration, and these pilots that have just been let out of, the cat's just been let out of the bag on, our opportunity there is to do something different than the Manchester proposition. And I have the privilege of chairing the Devo-Manc Partnership Board with Sir Howard Bernstein, the Chief Executive of Manchester. And so there is a proposition that works for Manchester, but the proposition that works for London is going to be different. It's going to have to be tailored to the boroughs and the different conditions and starting points and options that exist there. But nevertheless, we've got to get real on that care integration, and we've got to get real soon. And then the third piece that I would underline is the need to free up resource from all of this surplus property and underused estate that is sitting on NHS balance sheets, but which litters this city. And as Ara pointed out in his report a year ago, you could stuff Hyde Park full of the unused NHS property, which at a time when we desperately need that resource to reinvest in strong primary care services, in new infrastructure, in parts of the capital with growing populations where the facilities are not in place, that is now longer, we don't have the luxury of just kind of letting that trundle along as if nothing was happening for another 5 years. So prevention, care integration, infrastructure, those are things that we should hold ourselves collectively to account for, beginning now, over the next 12 months and beyond. And as we do that, we should refract our success through the lens of what it feels like for the people on the Angeltown estate. Thanks very much.